the upper appendicular skeleton, looking at the arm in the anatomical position. Here we have a muscle that goes from the coracoid process and inserts about halfway, 3/4 of the way down onto the humerus. So that's the coracobrachialis or coracobrachialis. I don't care how you pronounce it, just so you spell it. Here we have the biceps brachii, and if you were to trace it all the way up, you would see there's two heads coming up here. Turn it around, one of them is missing. Back here is the triceps brachii. As you go distal on the biceps, if you look on either side, there's a muscle that at the base called the brachialis. A couple of things about that. If you hold your hand in the anatomical position and flex your forearm, you're using the biceps to do the flexing. If you have your hand in the prone position and you lift the forearm, it's the brachialis that's doing the flexing. Biceps is much larger, stronger, thus if you're picking up something really heavy, you pick it up like this. When it's not so heavy, it kind of doesn't matter. Okay. Now we have small. Okay, I can use that one. Okay, we have a small model, but this is a model that shows some of the muscles a little bit better. This large muscle up here is the gluteus maximus, and it's large in the human just because the way we stand erect. In four-legged animals, this muscle is really kind of small. It's the gluteus medius, to a certain extent, the gluteus minimus that's a little bit larger. As I twist around so everybody can see. Gluteus medius, gluteus minimus. Those are the three gluteal muscles. The other models of the leg, in my opinion, do not show it as well as this one. Here's another model here where, if you look at it, you really don't see it all that well. It's better on this one. Piriformis. There's a group of muscles called the gemellus group, but the upper one is called the piriformis muscle. And this thing fans out, and the landmark on this is the nerve. Here's the sciatic nerve. And the thing is, sometimes if a person has sciatica, it is usually not what I'm about to say. It's usually not. But sometimes if this muscle freezes up, it clamps on you, it can press against the nerve. So here you have the piriformis muscle that helps rotate the hip. It's a fascia lata. So, if I go just anterior to the gluteus medius, there's a muscle here that's at an angle, and it's going to wind up on the crest, and it's going to go into something called the iliotibial band, this arrangement of connective tissue going down the side of the leg, and that's the tensor fascia lata. That's one of the ones that helps you stand erect. Tensor fascia lata. I have to switch to this guy now. On this particular model, where my finger is, hopefully it's still there, I have a muscle that goes diagonally across the thigh. It starts medially and it goes laterally, and that's called the sartorius. Sartorius refers to tailors. In the old days, tailors would do hand sewing by having their legs crossed. By having your legs crossed all the time, that muscle became very, very prominent. So that's why it's called the sartorius muscle. As far as I think, shoemakers, it should have been called the cobbler muscle, because I think it's even more prominent in people who make shoes with crossed legs. But there you have the sartorius muscle, so it's diagonally across. Just rotate along. So here we have the sartorius muscle going diagonally. Swing it around. We now have four muscles lumped together called the quadriceps. Quad means four. The one right smack in the middle is the rectus femoris. That guy actually goes over 2 sets of joints. When this thing flexes, it can both flex the thigh and extend the leg. The other 3 are right by it, and it's called vastus muscles. Now, on this particular model, the rectus femoris is not shown, but we have 3 vastus muscles. Location, location, location. This is the lateral side. That's the vastus lateralis. This is the medial side. Vastus medialis in between, right underneath or deep to the rectus femoris, is the vastus intermedius. As I rotate the back,
No hamstring.
no, this is not showing it. That's another leg. Okay. As we rotate to the back, there's a set of 3 muscles. There's a set of 3 muscles. The lateral one is called the biceps femoris. And here's where you have to be careful. There's 2 different biceps. So make sure you know the biceps brachii and the biceps femoris. The other 2, one is on top of another. The connective tissue on those are different. One connective tissue is very narrow and very thick. We call that a tendon. The other one is wider. The fancy name is aponeurosis, but it's more wider or more membrane-like. And that's where you get the names. One of these guys is the semi-membranosus, because the connective tissue is wider. The other is the semi-tendinosus, because the connective tissue is a narrow band. When you look at the distal end of these 2, you'll see a narrow band down at the bottom. I don't even know if I'm touching the right spot, but there, and underneath it is the other wider muscle with a wider band of connective tissue. Together, those are called the hamstrings. Okay. I'm following the sartorius distally and medially. There's a little triangle of blood vessels there. But the next muscle that comes across is the adductor longus muscle. Here we have this particular model. Sartorius goes across. Here we're going to have this muscle called the adductor longus muscle. As we keep on going and you're going laterally and deep, we have the adductor magnus. It's a deeper muscle, adductor magnus. So, adductor longus is here, adductor magnus is deep, and it goes, guess where it inserts? The adductor tubercle. There is a superficial muscle on the side. Okay, I'm skipping a couple. There is a superficial muscle on the medial side called the gracilis. If you follow the sartorius down and the gracilis, in the upper part, right in between the 2, is the adductor longus muscle. We're now up here. Here is a muscle that's in the iliac fossa. It's called the iliacus. Here's another muscle that originates from the lower lumbar and the sacral vertebra, and that's called the psoas major. Between the 2, they insert together into the iliopsoas. So here's the iliacus. Here is the psoas major. Now you have to know it as a psoas major because not shown is a psoas minor, and it's called the iliopsoas. Practical first aid. If a person has a severe abdominal injury, the least amount of pressure on the internal organs causes pain. If a person has a severe abdominal injury, you usually have them lie in the back with their knees bent. By having their knees bent, these muscles are in a relaxed position, puts less pressure on the internal organs. Pectineus, okay. The word pectineus means it's comb-like. In the ancient time, cones were sort of like made out of seashells that were like this. And here we have a group of blood vessels. On the lateral side, way up on top, that's deep, we have the iliopsoas. But on the medial side, we have this little group of fibers right in here. Make sure I'm touching it. That little group of fibers right here is the pectineus. When you did the femur, remember you had the gluteal line and the pectineal line. That's where that thing inserts. So okay. We're now behind the leg, and you have this twin muscle along here called the gastrocnemius. So now you can show off during Thanksgiving, instead of past the leg, say past the gastrocnemius. And that goes into the calcaneal tendon, in the old days also known as the Achilles tendon. Now, deep and lateral to that is a flat muscle. See, I think of fillet of sole, okay? That flat muscle is called the soleus. Sole is that flat fish, and it's just deep to that. One last muscle is as you run your fingers along the anterior angle of your tibia. If you go just lateral, the very first muscle you find is the tibialis anterior. The reason why I'm mentioning that is that's a landmark for feeling a pulse. If you were to put your hand across your leg, or anybody else's leg will let you, and you just go a little on the lateral side, you should feel a pulse there. If a person gets injured in the leg, that's one of the things they want to feel the pulse to make sure there's still circulation over there. So this is the last batch of muscles